So you're in the epilogue of Surviving Mold, and if you just pull this book off the shelf, it could be science fiction.
It could be.
But it actually happened. Yeah, fact. But it actually happened. And it reads a little bit like a novel because Dr. Shoemaker's telling stories of court and so on and so forth. But I think SIRS can be confusing for new doctors or the academic elite or a challenging husband or whatever because it was a medical discovery. Right. Think of the first 20 years of penicillin. Yeah. Think of the first 200 years of surgery. And Dr. Shoemaker first saw his first weird medical case that wound up being SIRS in 1996. And there are 4 diagnostic criteria for confirming SIRS that have evolved, and it's just gotten more and more and more refined. But that's because we kept getting advancements in laboratory technology, commercially available labs that historically were only available for research purposes, separating healthy controls who don't have these biomarkers up and new biomarkers. We have people like you who have worked in really poor counties and couldn't get all the markers all the time. Can you take us through kind of a medical anthropology stroll of all the different diagnoses and where that started and writing the Government Accountability Office's paper with Dr. Shoemaker, et cetera?
I can.
Yeah.
Yeah.
You were there.
Yeah. Well, for some of it.
Yeah.
So the first diagnostic criteria actually came from the CDC. Most people don't know that. Back in, it was either 1998 or 1999, Dr. Shoemaker had been doing his work with Pfiesteria in Maryland, and he had been collabing back before, collab was a cool word. And he was working with them, and they termed what they were seeing as PEAS, or possible estuary associated syndrome.
Peas.
And they created a 2-tiered diagnostic criteria for it, which included exposure and signs and symptoms. And of course, you had to get rid of confounders. So that came from the CDC. As Dr. Shoemaker went on, he learned about VCS testing from Ken Hudnell, who was working for the EPA at the time, and so a diagnostic criteria was created using symptom clusters and VCS testing. So as we know, symptom clusters are just taking, I think it's 35 of the 37 symptoms and breaking them into 13 different clusters. And that's usually done in cluster analysis, is done somewhat randomly. And if you show that you have a certain number of clusters, then that is significant. So for this illness, if you're an adult, which is defined as 11 or older, and you had 8 symptom clusters, then that satisfied the leg of diagnosis that had to do with subjective or symptom problems. And if you had an abnormal VCS test, then that would satisfy the objective testing. So Dr. Shoemaker went even farther, and he looked at false positives and false negatives, and this is where you get into statistics, and a lot of people get lost. But true positives and true negatives, he did a chi-square analysis, and what he found was that using those 8 clusters in an adult and a positive VCS test accurately made the diagnosis of SIRS 98.85% of the time.
Wow.
It's commonly used as 98.5, but I've actually seen the data. It's 98.85.
Wow.
So that's pretty good.
That's amazing. Let's put a quick pause on listeners who are new to this. And I know we have some people who are biotoxin trained and people who have been through this illness, but a cluster just means group, right? So
it's just a group.
He took 37 symptoms, and some of those are a dime a dozen. Who doesn't come into a healthcare office and complain of fatigue,
right,
or numbness, or tingling from back pain, or have an eczema rash and show skin sensitivity? But in these patients, 30% or more had this symptom. So of those 37 symptoms, at least 30% of his biotoxin cohort were expressing that symptom. And he took those 37 and he broke them into 13 groups. And some of the groups are single symptom group, like fatigue, right? Or focus and attention issues. Yeah, concentration. And then others, weakness and word finding ability are a group of 5 symptoms.
Exactly.
And if you say yes to 1 out of those 5, that is a positive group or a positive cluster.
Correct.
And then you're saying 8 out of those 13 for 11 and older qualifies as you should ideally move forward with the labs if you can afford them, the confirmatory labs. And for kids, 6 out of the 13 are confirmatory. And then the visual contrast, Kenneth Hudnell was seeing people who were getting exposed to nature toxins, biotoxins in seafood were not able to see visual contrast. They couldn't see blurred lines well. They couldn't see the edges of things. Night driving would be a good example of when your vision doesn't work. And they went to a conference in Florida, and they got introduced to the Heidelberg meter. And and this Heidelberg meter measures retinal blood flow. So it says how does a tissue stay alive and perform? Blood flow, nutrient dense oxygenated blood flow. And this machine was $150,000. And he was so curious and so smart and so well represented. They said, "Dude, why don't you borrow the machine for 6 months?" Imagine like just lending someone your $150,000 Tesla.
I'm going back to Germany. Have fun with my machine.
Have fun with my meter. And what he saw was that healthy controls had 400 units of retinal blood flow, and the biotoxin ill had 200 units of retinal blood flow because the inflammatory cytokines were gumming up the blood flow to the retina, and you couldn't see contrast as well. Then when he got him out of exposure, whether it's stop eating that fish and take cholestyramine or don't live in that moldy building, they went from 200 retinal blood flow units to 400. And I remember talking with him when we were in Pocomoke, when we brought the conference to him, saying, I'll never forget him saying this, the VCS was my first objective marker. Right? And so everything else was like, okay, these symptoms are getting better with this, or these symptoms sound like it. But if you put a violent sleep apnea next to a SIRS Lyme, next to a SIRS mold, next to a severe hypothyroid, which also drives multi-system, multi-symptom illness, next to a severe anemia, right, they're going to have a lot of overlap in symptoms. Right? So you need objective markers.
Got to have objective.
And what you're saying for our listeners, just to go, whoa, is a failed VCS with 8 out of 13 clustered symptoms or 6 out of 13 for under 11 is a 98.85% likelihood sensitivity that what you're seeing is CIRS.
That's correct.
That is crazy is what that is.
I'm going to fast forward just a little bit if I can, and then I'll come back to the real question. In 2017, I started looking at some of these things like VCS testing and physical exam findings and numbers of abnormal labs and things like that. And what I found was that if you failed the symptom clusters, okay, it was a very sensitive measure. And what that means by sensitive is that you're unlikely to miss anybody who has the illness. So if you looked at 100 adults who all had 8 clusters or more, they may not all have SIRS because it's not very sensitive, but they may have
specific.
It's not very specific, thank you. But it was very sensitive. You wouldn't miss many people who had 8 clusters because they have so many different symptoms. And so, but it's not very specific because they could have groups of illnesses that could cause all of those symptoms, put together. And then when you look at the abnormal lab testing, so you've got the subjective side with the clusters, you've got the objective side with VCS or lab testing. Those markers are very sensitive. So they might miss people that have SIRS, but if you have abnormality in those, the likelihood that you have some other illness or some other grouping of illnesses and it's not SIRS, very, very small.
So they're very specific.
So they're very specific.
Yeah.
And when you put the high sensitivity subjective with the high specificity lab tests, when you put those together, the objective test, you get results that are very, very accurate.
Undeniable.
And
as we have shared in other pods, that is why I'm comfortable telling someone they got to do a $40,000 remediation of their crawl space.
Absolutely.
If I didn't have that level of scientific assurance and reproducible published data, there's no way in heck
I
would feel comfortable, safe, honest to tell people this is an inconvenient truth, but this is what needs to happen.
And this may be a little esoteric, but I've been reading a lot about quantum physics and things and what they're doing as they're trying to understand what's going on in the quantum realm and different subatomic particles and whatnot. There's a standard model that has answered almost every question for the last 50 years in physics, but they still know that it's not complete because there's still a few questions they can't answer. But to find a new particle, they have to have data that is so robust that it meets what they call 5 sigma ratio. So that means that the data has to have at least 5 standard deviations. Again, we're getting kind of in statistics here.
Yeah.
But that is such an incredibly high level. That's like a P of 0.000001. Right? 6 zeros there. And that's the kind of a precision that they have to have. The most recent diagnostic criteria, which we'll get to in 2017, is at 4.87 sigma.
Wow.
And that's for the children, and for the adults is at 3.72 sigma, which is huge. It's huge.
So for our listeners, the way I explain a p-value is the statistical likelihood that this is not from chance.
Correct.
Right.
Yeah.
Would you? Because I look up to you for statistics and you and your chi-squares and your p-values, and it was. I can't explain it as well as you can, but from hanging out, I say if I have this, I have the deepest confidence that this is what's going on here.
Right. So another way of looking at a p-value would be if you did an experiment and the results came out with a p-value of, say, 0.01. That means that there's roughly, if you were to do the same experiment 100 times, the chances are maybe one time out of those 100 you would get a different result. So if it showed, A, it's going to show A 99 times, and it'll show some other result one time. When we're talking about a p-value with 6 zeros, 0.0000001, we're saying if you did the experiment 1,000,000 times, you might have one result that is different than the other 999,999. So, and that's the kind of precision that we have, or the kind of systematic error has been worked out in the diagnostic criteria that we have. It's pretty darn good.
It is the top of the heap for medicine.
It
don't
really
think
is.
People realize that you don't have that for remotely for statins or putting in stents or stuff that people do all the time that have not that great of consistent outcomes.
Right. Well, if we were to look at, say, diagnosing strep throat, okay, how many biomarkers need to turn positive for you to make that diagnosis? One. Yeah. It could be the swab, but if the swab is negative, you're going to do a culture. If the culture is positive, you're going to call it that. If the culture is not negative and you do an ASO, an anti-streptolysin antibody, and that's positive, high enough, you're going to call it strep throat. Okay, so you got three chances, and if any of them are positive, you're going to call it strep throat. Okay. In SIRS, at the highest level of diagnostic precision, you have to have 5 abnormal lab tests. That is unheard of in medicine. That is such a high bar. And yet my experience is with adults, they will all meet that bar if they have this illness.
Yep.
They will all meet that bar.
Right.
So going back to...
Double check. Yes, it is. Yes, it is. It really is. It really is. It really is.
Yeah. So going back to 2006, Dr. Shoemaker at that point had been seeing patients for about 10 years. He had seen Pfiesteria, Ciguatera, cyanobacteria. He'd seen mold. He'd seen Lyme patients and gathered data on all of them. And it's at that time that he published his 2006 criteria in Eckhart Johanning's book. So it was peer-reviewed by Eckhart Johanning. And it was a 3-tiered, and it was based directly on the CDC's evaluation of P's, the possible estuary-associated syndrome.
Gotta throw that litigious possible. We don't want to totally own this.
Exactly.
Someone might have to pay out.
But they did put the diagnostic criteria in one of their MMWRs. I have a copy of it if you want it. So he took their first criteria, which was exposure, and the second criteria, which was broken up into signs and symptoms, or signs are objective tests and symptoms are subjective feelings, like I feel tired or my back hurts. Those are subjective. Okay? So you had to have a certain number of each one of those. And then the third part that Dr. Shoemaker added is you had to have improvement when you had appropriate therapy. Right. So that makes
Which is a pretty cool one to add.
It is, but it's also very difficult.
To treatment.
Right.
Yeah.
But it's also very difficult when you think that the first step, step one, sometimes requires people to spend tens of thousands of dollars to remediate their house or change schools or change jobs.
That's a good point. It can be a pain in the butt to get through step one.
It can be impossible.
Yeah.
And then if you make that an absolute factor, and you can never accomplish that thing, you actually can never give the actual diagnosis of SIRS because you can't do step one. You can never show improvement.
Right. I would say about 50% of our 1,000 biotoxin diagnoses positive for SIRS are struggling and still slogging out the building.
Exactly.
And that is first and foremost financial, but it is also didn't get the right inspector before getting here and spent finances on the wrong remediator. There's so many ways. You're right that proving treatment could go wrong because step one is so complicated.
Exactly.
Yeah, it's
and
very
expensive.
It's very simple when you have the right people, and the right money.
Right.
But
that takes a lot of effort on your part to develop those people and develop the relationships and whatnot.
And that's really why we're the main reason we're doing the SIRS X Institute. There's going to be all kinds of great programs, but training remediators.
Right.
To understand SIRS level clean.
In a systematic way.
In a systematic, organized, centralized way with checks and balances and sequencing and is man, it's going to make our lives easier.
I agree. So going back to Dr. Shoemaker's diagnostic criteria, at each level, there are specific criterion that have to be met. So for the exposure, you have to show that either there are musty or mildewy smells, or you have to show that there's actual visible mold, or you have to have commercial testing that shows, like, from an ERMI or spore trap test, but that there's actually elevated amounts of indoor mold. So you have to show at least one of those three things.
Similar to the 2009 WHO paper, right? You have to see it, smell
it's the 2008 GAO,
or commercially test for it.
And really, that's what the CDC's guidance documents today say, which is if you can see it or smell it, most of the time you don't even need to do testing. Unless you're going to sue, then you always do testing before you leave. But if you can see it or smell it, it needs to be remediated. And that's a message for landlords out there. If you or your maintenance people or the tenants can see it or smell it, you are obligated by federal law to clean that up and to do it right.
Physical removal, not slap coat of kills on it.
Oh, are you, sir? Yeah, or some paint on the ceiling.
Or don't do that one YouTube guy and lick the mold.
Lick the mold. Well, that's one way to get it off. But I think it grows back.
It does grow back. Yes.
And unfortunately, that's the same if you use bleach or something like that and you get rid of it, it grows back.
You got to deal with the source.
You got to deal with the source.
You got to remove all water damaged materials, dry rot.
Exactly.
Water stained.
Right. So that's exposure. And then the second tier has two parts to it. The first one is the subjective. It's the symptoms. It's the ones that the patients say, this is how I feel. This is what I'm experiencing. And there again, we're looking at, for those who are 11 or older, we're looking at 8 symptom clusters, positive or more. Could be 9, could be 10, 11, 12, 13. And for children, 6 or more. And then for the objective portion, there were 6 tests that Dr. Shoemaker had at that time, 6 biomarkers. And one of them was the VCS test, and one of them was the HLA, the human leukocyte antigen, the genetic predisposition test. So that was the second one. The third one was MSH, and we would expect that to be low. The fourth one was MMP9, the matrix metalloproteinase number 9. And then the last 2 had to do with your endocrine system. So they're the ACTH with cortisol that's obtained at the same time and preferably in the morning. And the ADH or antidiuretic hormone and the serum osmolality that are obtained at the same time. And so to qualify for that criterion, you had to have at least 3 of those 6 different biomarkers needed to be abnormal. And then the final one was that you have to show improvement. And there are different ways of interpreting what that is. But to me, that means that you, like if you moved out of your house or you moved out and you took some cholestyramine, that you had symptom reduction.
You feel better.
You feel better. Exactly. So that's Dr. Shoemaker's protocol. In 2008, the Government Accountability Office of the United States published their report on indoor mold. And on page 8 of that is an algorithm that they developed that didn't look specifically at SIRS. It looked at every mold-based illness. And they came up with 3 criteria. And interestingly enough, they exactly parallel Dr. Shoemaker's 2006 criteria. So the first one is exposure, and again, it's from visible mold, musty, mildewy smells, or commercial testing that shows an elevated amount of microbial growth. And then for signs and symptoms, they don't give a specific number of symptoms that you need. It just needs to be consistent with what the animal and or human literature shows that when people are exposed to mold, you get those kind of symptoms. Right? So one way to approach that is to look at the symptom clusters. Another way is just to look at the 37 diagnostic symptoms. You've got 25 of them. Well, that's pretty good evidence. Okay. Then for the Government Accountability Office's 2008 report, they again don't give specific objective evidence because they're trying to make a very broad algorithm, a broad definition, so that you can diagnose any mold-based illness based on these 3 factors. And so you can use physical exam findings, you can use VCS testing, you potentially could use NeuroQuant or Gini findings that have been peer-reviewed and published and shown to show up in people, as well as the blood tests and the Marcon's tests and whatnot. So there's a whole host of possible biomarkers you could use. Yeah. And then the third criteria, again, was that you had to show improvement. Okay. Now, one of the things that's interesting about the GAO, and this is more for providers, is it loosely follows Koch's postulates. Now, for the non-providers...
K-O-C-H.
K-O-C-H, apostrophe S.
Not diabetes Coke.
Right, yeah. and not a Coca-Cola.
Yes.
Okay. So Koch's postulates came about to prove causation of a particular germ as a result, or that to show that that particular germ caused that particular illness. And so the example would be like, say, strep throat, and you would have somebody who had a sore throat, and you'd swab it, and you would find that they had group A beta hemolytic strep, and then you'd treat it with something that you know kills group A beta hemolytic strep, and it goes away and they get all better. And then you intentionally put the group A beta hemolytic strep back in there, and you see that they develop the whole syndrome again. Okay? Those are Koch's postulates. So other than the part that you intentionally re-expose somebody to the affected agent, the Government Accountability Office of the United States algorithm follows Koch's postulates for causation. And that's specifically what the algorithm is about, is proving causation that mold caused a mold-based illness. And that is really important, particularly for legal cases, because the government has given us a pathway to show that there was actual causation by the organisms that we're finding in people's houses and the illness that they get.
What a refreshing moment in government accountability.
I know. I don't think they knew that at the time.
They didn't know they were doing such a good job.
Yeah.
with that
So
one.
yeah, thumbs up for them.
Thumbs up. And I think that's important for legal cases, but it's also important for someone who's been chasing answers for their mystery illness forever to just see that so well done, and to see that there is this is what drives me crazy about urinary mycotoxins. This is what drives me crazy about anything that's unsubstantiated. Is I don't think it's intentionally predatory to the chronically ill.
Right.
But you're dealing with someone who's pretty burnt out. They need organized, documented, reproducible methods to reinstill hope.
And they need something that stands up in court.
And something that, right. Well, Dr. Shoemaker always told us you should practice like you're presenting in court.
Right.
And if you're going to hold up in court, you're probably going to nail an honest diagnosis.
And periodically, people's licenses come for review. And if you're making diagnoses and you're not using peer-reviewed, published ways of making the diagnosis, you really won't have any way to defend yourself.
Castles made of sand.
There you go.
Yep.
So those are three. And then in 2017, some guy named Dr. McMahon.
I know that.
Well, that was me. Yeah.
I know that, dude.
I was just starting to do some legal work, and I was very frustrated trying to do chart reviews. So, oftentimes when you're evaluating a patient, you'll get their old medical records. And I go through the medical records, and I couldn't establish a diagnosis of SIRS from their medical records because a lot of doctors didn't know the right questions to ask.
Right.
Even people that are treating them for SIRS oftentimes didn't document that they had asked the right questions.
And I call that unintentionally sloppy if you haven't bumped into Dr. Shoemaker's peer-reviewed reproducible work. Just sloppy if you have. You know, because again, you can add your shtick, but if it's going to be the shtick, you have to collect the data and publish.
I use a different adjective, but yours is good. By the way, you look very much like Matt Damon. Did anyone ever tell you that?
No.
Like in Martian.
All right.
Yeah.
Well,
you might have a new career here.
What are we watching, Roswell? Mutant molds from outer space.
That was a great documentary. I have a copy of it.
To think that there is microbial growth on the
on the space station.
On the space station.
Yeah, and they can't get rid of it. Yeah, there's mold everywhere in places that humans couldn't exist, like a space station without.
We got to put Arnold in like a movie like Das Remediator.
He could be the Predator.
Rip it all out. It's a crisis situation.
Yeah.
We need to get all the water damage out now.
Yeah. Got my flamethrower.
I wish there was a gamma ray. I wish there were sharks with laser beams that could just take the microbial growth out of your house.
Right.
But you need to do it with physical removal.
Exactly.
Yeah.
So that was
my dude.
So that was frustrating. And then I read a case where somebody was trying to apply Dr. Shoemaker. Somebody had diagnosed a client with Dr. Shoemaker's criteria, but the patient didn't meet all the criteria. and that person got thrown out as an expert witness.
Wow.
And I thought, well, that's a
bummer.
mistake that I would rather not ever make. But I kept coming back to, number one, the chart reviews are very difficult because many of the doctors don't know the right questions to ask to cover that diagnosis. And the other problem was that people weren't always able to complete step one. Now, an analogy of that would be if somebody came to your office and they said, my ear hurts and I've got 102 fever. Would you look in my ear? And you took your otoscope and you looked in there and you saw that the tympanic membrane, the eardrum, was bright red and bulging. It's obviously an ear infection. And you give them either, something holistic, antibiotic, vegetable, maybe cucumber. No, I'm just kidding.
I actually have great otitis media treatment.
Okay, yeah. Or, you do whatever you do for otitis media, and you say, okay, I need you to come back in 10 days, and I'll look in your ear again, and if it's all cleared up, I'll be able to make the diagnosis of otitis media. But until then, I can't make that diagnosis. And that was the handcuffs of Dr. Shoemaker's 2006 and the Government Accountability Office of 2008's diagnostic methods.
Yep.
And so I just started thinking about it. And
again, what if someone's trapped in buildings?
Exactly.
Right. And
then you can never get
the
diagnosis.
Some of the most affluent people, and we've seen people who are literally stuck in a fixed income, rent-controlled building. And
Exactly.
they're not getting out of there. And
Exactly.
the super is not hiring a CIRS-aware remediation company to do things right.
That's exactly right. Even though their state, requires somebody that's licensed for mold remediation
right. They're going
to do
air
the work.
sample that thing and whitewash it. And
Exactly.
Yeah.
Kills time.
Yep.
Let's kill some time. Yep. So that's where we came up with the 2017 version of it, what I call alternate means. And when we did that, I looked at a number of different factors. I looked at I looked at the specificity and sensitivity, like we were talking about earlier, of different factors, different things that we could evaluate in CIRS patients. So one of them was symptom clusters. And again, I found that they were very sensitive. So if you're an adult and you didn't have 8 symptom clusters, it was very unlikely that you had CIRS. That's really the easiest way that I know to explain sensitivities.
It happens, but it's rare.
Right. It finds it most of the time. It rarely will miss the illness in somebody, but they weren't specific. Right? And I looked at VCS testing. I looked at numbers of abnormal lab tests and some other things, physical exam findings and whatnot. And what I found the most sensitive measure, the most specific measure, were the number of abnormal lab tests. And so by specific, that means if you meet that criteria, you have CIRS, you don't have some other illness. It's CIRS. Okay. So specific and sensitive, when you put those together, that's dynamite. That is absolutely dynamite, because now you have a very, very effective way of making the diagnosis. And so what we found is that for children, again, we use 6 clusters and 4 abnormal lab tests of the normal 10, and I'll go through those in a second. And for adults, it was 8 symptom clusters and 5 abnormal lab tests. And we found that combination was dynamite, and we did chi-square analysis with false positives and false negatives, kind of like Dr. Shoemaker did with the VCS test. And we came up with those numbers that were just outstanding. It's like 1.1 error in a million on children, and less than 1 error in 5,000 on adults for their what's called alpha error. So, I mean, those are really good. Those are amongst the best diagnostic criteria you'll find anywhere. And what that really means is that they look at Dr. Shoemaker's criteria and they look at the GAO criteria and they approximate them very, very well without having to include the getting better part. And so I never thought
about that work from that perspective. I thought about it more as like if you had post-Katrina And you really needed to just say, do we just need to get these people loaded up on fish oil and cholestyramine because we don't have time or resources, or even the lab got washed out. That's how I've always thought about your paper.
Yeah.
And the 2017 paper on basically alternative diagnostic means. I didn't think about, it relieves you of the burden of having to break through step one, remove patient biotoxin exposure, and then to prove like the penicillin worked to eradicate the strep,
And that was the primary goal was, is there another way to make the diagnosis that, is still very, very accurate, but doesn't require you to go through step one because so many people are unable to.
Yep. Which is heartbreaking.
It's absolutely heartbreaking because you and I know that is by far and away the most important step.
My dream for this illness is, I really think Israel does something cool with civic duty or military duty, where you're post high school, you either go do 2 years of military or 2 years civic. So if you don't want to, learn how to do jiu-jitsu and handle a Glock, you can go feed the homeless or staff a hospital.
Can I learn Krav Maga?
You can learn Krav Maga.
Okay.
Yes.
Okay.
Yes. Yeah. Don't choke someone out when you can steal their gun first.
Right. So when you say jiu-jitsu, are you making an Israeli joke there?
No, but that's pretty clever. I never thought about that.
Thank you.
Yeah.
That's why they have Krav Maga. So.
Well, it was Japanese jiu-jitsu, and then it went to Brazil and became refined as Brazilian jiu-jitsu. And
sweep the leg. Sweep the leg.
And I think of the youth and just how many people are looking for a sense of purpose. And I would just love to do something like an AmeriCorps HLA test people.
Right.
And say, okay, you're statistically less likely to go immune reactive working in buildings. We're going to get you proper PPE, which I'm going through that slide deck right now in the CIRS remediation course. Like, I can't tell you how many people don't wear proper PPE when they do this work.
Right.
And then start getting after schools, gyms, YMCAs, churches where we're having anonymous meetings. And people get spiritually and emotionally uplifted, but they turn their CIRS on and then they go endorphin seeking with drugs and alcohol.
Yeah.
How many buildings we have to conquer seems overwhelming. But if we could do it in some kind of empowered national movement that could become a global movement, because Jody, who sees some patients from India, when you talk about the buildings they're dealing with, it's even more intense.
Exactly.
So I'm glad you have that alternative diagnosis, because getting past the building, it's not like taking an antibiotic for strep. I wish the building could be like taking an antibiotic for strep. It would be, So I know we got to wrap it up, but I wanted one more explanation for our listeners, a factual explanation, because you were like, and then you re-inoculate with strep and you watch the symptoms again. Well, that's interesting that's a dangerous study because of rheumatic heart disease and kidney failure. We kind of did that.
Particularly when they didn't have antibiotics.
Right. Did the silver work? Did the gold seal work?
Right. I think he came up with this in like 1830 or something.
Yeah,
like
totally.
100 years before sulfanilamide.
Yeah, you better know a grandma who knows her herbs, And that's the SAIIE trial. And for our listeners, that's sequential activation of innate immune elements. And sequence means chapter. First this, then that, then those. Activation means turn on. Innate immune elements means innate cytokine storms, basically. Right. Can you teach our listeners about this heroic patient population that worked with this heroic Dr. Richie Shoemaker to do this?
I met him once.
You met him once.
I did.
But this is one of the most impressive things I think he and his dedicated patients did. Everyone in that group had such grit.
So the SAIIE. Thank you. SAIIE. I say AB prime AB.
Yeah,
but it's exactly the same thing, but that's the one I usually say.
Yes.
SAIIE. Yeah. So this is a way to, beyond a shadow of a doubt, document that a suspected building is a trigger for somebody. And the idea is you take somebody and you treat them so that they're feeling very good. And ideally their symptom list should be down to that 2 to 3 symptoms or right in that neighborhood of average that you would find in somebody who doesn't have the illness in a healthy control. And then you intentionally put them back in the building that you think is what's making them sick 3 times. Before you do that, you collect some lab work, you do a VCS test, you get their symptom roster, and then you send them, like say it's a workplace, you send them back into their workplace off medicine, off cholestyramine for 8 hours. And then the next day, you collect another VCS test, another symptom list, and you get the same blood tests done. And then you send them back in for another 8 hours. And then they go home, and then the next day you collect again a third time. You collect the VCS test, the symptom list, the blood work, and you send them for the third time into this building. And the following morning, you collect blood the 4th time. So it's once before as a baseline that you're getting VCS testing, symptom lists, and these certain blood tests. And then 3 times, like within 12 hours of the time that they finished, give or take, 12 to 16 hours of the time that they finished their time in that building, 3 days in a row. Takes a little while to get the results back, but when you get the results back, what we typically see is if that building was bad, we'll see that their VCS tests will get worse. We'll see that their symptom lists go back to very close to where they were before they were initially treated. And we'll see that certain lab markers will go up, down, or up and down. Like, for instance, C4A can go up in 4 hours. So usually by the next day, it's elevated. TGF-beta-1 takes longer. MMP9 goes up, and then it goes down. Or it takes longer, and then it goes down. So you can use that to show that it's absolutely positively that building that is making somebody sick. The problem is you have to make that person sick in the process.
Yeah, and you have to say it in an old school nature cure voice. This building is making the patient sick.
That's right.
But that was powerful because that was undeniable. And that was a lot Dr. McMahon just dropped. So just again, we learned C4A is the quickest of the 3 cytokines on average, statistically. So boom, it can go up. MMP9, TGF-beta go up over 24 to 72 hours. Yeah. And then some people are what I call MMP9ers or C4Ers or TGF-betas, and they have one pathway that's more.
Right.
But when I give kind of like the umbrella of that, because that was what I want our listeners to have as details. But these patients were sick. We had baseline markers proving it. We had a Hertzme-Erme documented safe house. We put them in that safe house, and those inflammatory markers did not come down.
Right.
And that's why you need step 2.
Right.
They were put on cholestyramine well called because they had to drain the remaining biotoxin reservoir, and then the markers and the symptoms radically diminished. Right. And then that proved treatment but didn't prove cure.
Right.
So then we took them off the cholestyramine well call, redid their markers, and the markers stayed down and their symptoms stayed at bay. And all was good, and you were cured, ... until your next major exposure.
Right.
And then you put them back into the building. And
Intentionally.
And day 1, you got a fistful of cytokines.
Well, and make sure they sign an informed consent before you do this.
Yes.
But this can be very helpful in, for instance, say a legal case.
Yes.
Or if you have a spouse.
Or a douchebag husband.
I was going to say spouse. I heard you talk about spouses earlier.
Honestly, I have a lot of compassion for the husband because by the time they get here, they've spent a lot of time, money, and energy chasing a spouse's illness. It can go both ways, but a lot of times, on average, we're dealing with a grumpy husband who's frickin' burnt.
Right.
Hasn't had a real vacation with his family, spent tons of money,
draining the savings account.
Yeah. Yep, and it's like, what's going to be different about this guy?
Right.
You're seeing a bunch of quacks who aren't helping you.
Right.
And we have cupboards full of supplements and IV treatments and seeing Mayo Clinic and everyone in between. And what's going to be different?
Right. I get it.
Yeah.
And what's different is that when we do our lab tests, there's a bunch of objective abnormal tests.
Yes.
That's what's different.
And when you explain the biotoxin pathway and they can see their spouse there, and they can see the dead libido and the crashed androgens and why they can't ride a bike, go for a hike, why they're always complaining about headaches, et cetera, et cetera. It's
dead libido after that.
Yeah.
I mean, are there any symptoms? I mean, that's it, man.
That's the tip of the iceberg for marital tension.
Yeah. And that and finances.
Yeah.
So as you see the finances go dribble down the drain, and you're right, because you go and you get a wrong diagnosis and then you get a wrong treatment and you don't get any better. And then you have just drained the bank account again. And how many physicians, how many providers of various different types do you have to see before that becomes frustrating and before you don't have any hope?
That's it.
Yeah.
Well, you give people the most wonderful data-driven hope. I am in awe of the spiritual fumes you ride on with your 2 hour, 4 hour, 6 hour night of sleep. Everyone needs to understand Dr. McMahon is a father to 8 kids. He has a clinical practice. He was a pediatrician full-time for 25 years. He still does rounds in the hospital. He publishes peer-reviewed publications for the SIRS community, data-driven truth to inform policy, and he helps train other doctors. He takes calls with remediators, inspectors, lawyers, and is our number one expert legal testimony. And the reason I think by the grace of God, you take that job on. And I think it is your big brain with your big heart that stayed up till 3 a.m. that commands the peer-reviewed published literature that allows you to not get bullied in court when you're fighting for the lives of these patients.
Yeah.
We love you. We appreciate you. We all aspire. And we hope to clone you through CIRS Institutes. Maybe we'll have to call Elon.
I was going to give you a sample. Clone away.
We might have to call Scully and
get some sleep
and visit Area 51.
Area 51 is actually like 750 miles from where I live. It's in Nevada.
Okay.
But we do have a store called Area 52.
Area 52, okay.
Yeah,
yes.
You can buy all your little aliens.
Yes.
Yeah. By the way, I've lived in Roswell now for like 31 years, and I see aliens all the time. I have one who lives in my house.
You're not talking about your
it's
teenage child.
No, it's my father-in-law. He's a legal alien from Nigeria. There are aliens all the time. There's some illegal ones too.
Yes,
okay? Yeah. More so over the last 3 years.
And they deserve clean buildings and health too.
Absolutely.
And that's what we want to see. We want to start with all the resources we have in America, but then take on a global campaign to eradicate this illness.
Yeah.
And I'm on your coattails, brother, and
Cool.
enjoying every minute of the ride.
I'm enjoying the ride too. And every once in a while I get an hour of sleep.
Yeah. Amen.
So by God's grace.
Thanks for making the time for us. We really appreciate it.
Likewise. Thank you for giving people the opportunity to share and to spread the word. And thank you for all the work that you do at your clinic.
What was it? Cubic Governor Jr. said, "Show me the money." Your line
Show
is,
me the money.
"Show me the data."
Show me the data. Do I have to dance around in my skivvies?
Show me the data. Show me the data. Show me the data. Show me the data.
Show me the data.
Show me the data. Show me the p-values of 0.000001.
Right?
Yeah. So here's to data. Here's to service. Here's to helping eradicate this illness.
Amen.
Cheers.
Thank you.
Amen.